Hi, Mrs. Benton.
Hi.
There. I'm Dr. Geertz. I'm one of the blood clotting specialists. I just wanted to introduce myself and see how you're doing. I gather you... This is Gloria Benton, who's a delightful 85-year-old woman who earlier this week fell and broke her hip. And she had surgery for the hip fracture and is now awaiting transfer to rehab in anticipation of going home. With the routine use of thromboprophylaxis, we expect that neither the patient nor the caregivers for Mrs. Benton should have to be concerned about thromboembolic complications occurring. Venous thromboembolism, which is sometimes known as VTE, consists of two related conditions: deep vein thrombosis, or DVT, which is a blood clot that develops in the deep vein of the legs, and pulmonary embolism, or PE, which occurs when a blood clot in the leg veins moves through the bloodstream and ends up in the lung. And it results in some bad things that happen to patients. It results in leg swelling or leg pain. If a person has pulmonary embolism, it results in shortness of breath and chest pain, can cause the patient to pass out, and occasionally kills the patient. It's one of the commonest complications. After major general surgery, for example, if you don't give medicine to prevent venous thrombosis, it occurs somewhere between 10 and 40% of the time. And after major orthopedic surgery, it occurs about 50% of the time in patients who aren't given medicine to prevent them from getting clots.
So this particular intervention will give people an opportunity to really have a formalized way of delivering appropriate venous thromboembolism prophylaxis to patients that meet the criteria. So we're going to ask hospitals to track which patients are receiving appropriate thromboprophylaxis and which are not. And when it is identified that patients are not receiving adequate or appropriate thromboprophylaxis, we'd like to track the reason why.
And the reason that we're launching the Safer Healthcare Now campaign to prevent thrombosis is because of this gap between what we know and what we do in hospitals. Despite the extensive knowledge about thromboprophylaxis, adherence to prophylaxis guidelines is less than optimal. We know, for example, that approximately a quarter of all major orthopedic surgery patients don't receive appropriate thromboprophylaxis. And more than half of the major general surgery patients across the country do not receive appropriate thromboprophylaxis. This is an important knowledge care gap that we need to fix.
From what I understand from past interventions with Safer Healthcare Now, that often the stumbling block is the collection of the data. So we've tried to keep that very simple, primarily by narrowing it down to two specific groups, and also by having the data that's to be collected be very clear, straightforward, and easy to find in a chart. So I think those things should hopefully help people with that particularly challenging piece.
Clearly, clinical judgment is required for all medical interventions, but there are some things that are so important and so common and done the same way so often that a system should be in place to make sure that that happens, and only if there are exceptions to that would you not follow the recommended rule.
So the Getting Started kit should hopefully provide people with all the information that they need to be able to proceed with the intervention. Part of the kit will include tools to help people collect the data, and also tools to help them achieve the 100% goal of providing all patients with appropriate thromboprophylaxis.
So given the high prevalence of venous thrombosis in hospital patients and what we know about the consequences of failure to prevent thrombosis, prevention is the key to reducing this complication.
No, it's not rocket science. It's the evidence is out there, it's clear, and everybody agrees that it's a concern and that it is preventable. Patient safety is our responsibility, so I invite everybody to join the VTE intervention, and I look forward to working with everyone.